Hi, and welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Lynn Marie Morski. She's a physician, attorney, and president of the Psychedelic Medicine Association. We're going to talk about the Kevin MD article, the importance of physician education regarding psilocybin therapy. Lynn Marie, welcome back to the show.
Thanks so much for having me, Kevin.
So you're president of the Psychedelic Medicine Association. How do you get interested in this area?
I was working at the VA for about 9 years, and a lot of the patients I would see come through there obviously had a lot of mental health issues. And in that same period of time, I was learning what psychedelics could do to help a lot of those same mental health issues that I saw just weren't being properly addressed or sufficiently addressed. I know doctors at the VA were doing everything they could with the tools they had, but still PTSD was really predominant and depression. And I was seeing where psychedelics were being shown to be effective against depression and PTSD. And so I got really interested in that because I saw, man, if I could get these medicines to the patients that I'm seeing that really need it, but obviously there was this chasm, like these medicines still weren't legal and a lot of clinicians didn't know about them. And so that's why first I started the Psychedelic Medicine podcast to try to educate people as a whole. But then I founded the Psychedelic Medicine Association specifically to educate clinicians, because that's who the majority of people go to with their medical questions. I know a lot of people go straight to WebMD, but still a lot of people go to their family doctor or their psychiatrist and say, I'm struggling with this. What can I do? And I wanted clinicians to know that psychedelics are an option that either is available today in the case of ketamine or case of psilocybin in Oregon, or that will likely be available soon.
And let's set the table. Specifically, we're going to talk about psilocybin. So tell us what the current state of that is and how often it's being used.
So psilocybin in the United States is currently legal only for adult use in Oregon. And it's in a very specific model where you have to go to a licensed center that has gotten their psilocybin from a licensed grower, and then you will see a licensed facilitator. So it's a very regimented system, but you can come from other states. You don't have to be an Oregon resident to take advantage of this. And then psilocybin is decriminalized in other places in the country, which means it's not legal. You can't sell it, but it is not criminalized. So you are allowed to have it, or it's like the lowest priority on the police's docket. But for actual, clinical use, if a doctor wants to recommend somebody go do psilocybin therapy, the only legal place in the US right now is Oregon. Colorado has passed similar legislation. And so in the next couple of years, psilocybin, along with a few other natural psychedelics, should have the same kind of structurized adult use program.
So let's go even further back than that. What exactly is psilocybin and what are some of the indications used for it currently?
Psilocybin is the active ingredient in what most of us colloquially know as magic mushrooms. And psilocybin has been shown to be effective in things like end-of-life anxiety, which is one of the first studies, extremely effective when added to CBT for tobacco cessation. They're finding it effective in major depression, treatment-resistant depression. Studies are coming out showing that it has some efficacy in anorexia. It's also being studied for things outside of the mental health realm, like migraines and cluster headaches. So it has a wide range of uses, and it's likely to be the second FDA-approved psychedelic. MDMA is likely to be the first, but psilocybin is entering in phase 3 trials at this time.
All right. And in your Kevin MD article, you talk about the importance of physician education regarding psilocybin therapy. So go into your article. Why did you write it?
So, like I said, in Oregon, now this system is up and running. And so imagine if you're a primary care doctor in Oregon and your patient comes to you and says, I hear about these psilocybin centers. I see that, a lot of people are really interested. Could this be effective for me and my, enter condition they're concerned about? And also, is it safe for me knowing that I'm taking XYZ medications and my mental and physical medical history is this? And our concern is that since we were not educated on psilocybin in medical school, that a lot of primary care and other physicians across Oregon, especially, are going to be caught a little bit deer in the headlights. And so we really wanted to, in the Psychedelic Medicine Association, it became very important for us to focus on Oregon and get doctors there up to speed so that they'd feel more comfortable talking about the indications, talking about the contraindications, and doing, at this point, we can't do an actual medical clearance for it because we don't have enough data. If you're going for surgery, you go to anesthesia, they do your medical clearance. Well, first off, we don't have quite that set up yet where we're going to send somebody to
Hmm.
anesthesia. But, if you're the PCP, you're going to have to do kind of a basic risk assessment, look at their medicines, look and see if there's any, drug interactions with psilocybin, look at their particularly psych history and heart history and see if those might make it more or less risky. We can't really say, absolute contraindications at this point because there haven't been enough studies done. But we wanted to get doctors starting to feel comfortable having those conversations, especially in Oregon.
So let's say I'm a primary care clinician in Oregon and take me into an exam room. What would a typical patient request, or what would a typical case look like where psilocybin would be considered?
So, like I said, for somebody who might have major depression, treatment-resistant depression, those are great starting points for psilocybin. And another thing I will just kind of pop in here is that to use Oregon's system, you don't have to have an indication. A lot of people undergo psilocybin and other psychedelic journeys just for general well-being or some introspection. But there are some indications, like I said, end of life anxiety being one of the first studied, tobacco cessation, any of those things that the patient may be concerned or wishing to address. Those are great starting points. There's a lot of research on those. But that patient might come in and say, I'm taking this antidepressant. Will that affect my psilocybin journey? And so then, there's a list and you can kind of cross-reference. And they might also say, well, I have a first degree relative that has history of psychosis, or I myself have been diagnosed with bipolar disorder. And unfortunately, for example, those are two areas that research is not fleshed out enough yet to
Hmm.
make a decision. There's ongoing research in those areas, but at this point, the doctor may tell the patient, we don't know enough to say it's safe in those areas. Same with pregnancy. We don't have any research on that yet, but the doctor can at least give the patient the knowledge that, yes, those are concerns. We're not saying it's an absolute contraindication, but so far hasn't been studied. Or if the patient comes in and doesn't have any of those, mental or physical conditions in their history, the doctor may just look at it, the drug interactions, make sure everything's okay. Say, okay, your heart seems to be okay enough, because most of the psychedelics can transiently raise, heart rate and blood pressure. And they may say, look, yeah, go ahead. This seems to be safe for you.
What kind of forms does psilocybin typically come in?
So in Oregon, there are two forms, like generally. One is the natural mushroom form and the other is synthetic. And the way that I believe they're doing it at Oregon is they are growing one certain specific type of mushroom, and then they, process it to come in a capsule so that we have exact like milligram or gram amounts. Because when you just eat the raw mushroom, it's harder to get the exact amount. So that's part of what Oregon has done to standardize it. So if you're taking it in Oregon, it will probably come from a natural source, but in a capsule form.
Now, if I'm a clinician considering psilocybin for, say, depression, what kind of questions should I ask myself to make sure that this is right for the patient versus, say, an SSRI?
Well, and again, this is where it's not an either or. It may be an issue of like they've tried an SSRI and it
Mm,
wasn't working, or it may be what you want to try as first line, and it's just kind of individualized. Like the SSRIs have side effects. They might work for some people and maybe they're working for somebody, but they say the side effects are really, bumming me out more than the depression was. And so that may be an indication where, hey, let's try psilocybin. Because something that I should have pointed out at the beginning is that with the psychedelics, psilocybin being a great example, you don't take this every day. You generally do 1 to 2 higher dose sessions with therapy, with preparation, and with what we call integration afterwards, so that you can integrate what you saw or felt or learned in your specific medicine day. So it's not like, okay, versus taking an SSRI daily, now I'll be taking psilocybin daily. It's either take an SSRI daily or maybe do 1 or 2 times with psilocybin. And then the goal is to not have to be taking
mm,
something daily. And so it may be that, somebody really is maybe, let's say, slightly fearful of a psychedelic journey, or maybe it's not medically indicated for them, start with the SSRI. But if somebody is healthy, willing to try the psychedelic, it may be, generally these go in and they address the root cause of the depression, as opposed to SSRIs that are generally trying to address the symptoms. And so that's another thing to decide. Like, if this patient's ready to maybe delve into the root cause, maybe try psilocybin.
So, from a patient standpoint, when they take these psilocybin capsules in Oregon, what would be a successful example? What would they feel like when they take these?
Well, and just to be clear, we don't want to set any expectations because people's journeys can look very, very different. But what we would hope is that two things happen. Psychedelics not only work by like having some kind of like hallucinatory journey, which is generally there, but also they work on a physiologic level. They work on the serotonin receptor, and they lead to a lot of neuroplasticity, and they reopen critical learning periods and all these things. Like, so, some of those periods you had when you were younger and able to reform neural pathways, those are reopened. So regardless of whether you have a crazy hallucinatory journey that shows you anything, gives you any insights, you probably will still have those physiologic factors. So if you don't have a crazy journey, don't think, oh, I've failed psilocybin. The psilocybin still worked on you in some way. But that's secondarily during, the hallucinations that can often come with these psychedelics. Very often it elucidates some negative pattern of thinking, some limiting belief, may highlight some old trauma that's causing the PTSD, causing the depression, and it may help you reframe it, or may take the fear center away a little bit for a minute so that you can take a good look at it, readdress it. And then generally after that, hopefully that event has less effect on you overall, meaning that it should be causing less depression or less post-traumatic stress.
Any concerns about psilocybin being habit forming?
No, psilocybin is not shown to be addictive. And in fact, many of the psychedelics are shown to have anti-addictive properties. So they can be used, like I said, in the case with tobacco cessation, to help somebody address addiction and become part of their, their withdrawal or their sobriety journey.
Now, what about the cost? What's a cost of a typical regimen of psilocybin?
So in Oregon, that is kind of the biggest issue, because it is fairly costly at this point. And the price is per amount. And so if you're taking a larger amount, then you have to pay more, because the journey will probably be longer, and, they're having to buy more psilocybin, but it can get into the thousands of dollars. I think, $3,500 is something we've seen. And if you're looking at that as a one-time cost, that, that might be a lot upfront, and, especially because it's not covered by insurance. But again, I just want to reframe that. Yes, that is costly. There are places outside of the US, again, much less regulated, that have different prices. But with a lot of these psychedelics, while they have kind of, maybe a sticker shock upfront cost, what you have to look at is the fact that you're not having to pay for an SSRI every month. If this happens to be, let's say, successful at addressing something like depression or PTSD, you may not have to pay for nearly as much therapy. Let's always hope somebody still goes to therapy, but may not have to be so intensive or so frequent. You may not need to pay for a number of medications. And then on the other end, they did an MDMA, for example, cost effectiveness study, and the amount of disability that people were having to be paid out by the government for, loss of the ability to work from PTSD, that cost was so, once you looked at all of those costs, the upfront cost of the psychedelic was significantly less. And so, yes, it's a little pricey on the upfront side and is not yet covered by insurance, but that is also being worked on.
I decided psilocybin would be right for my patient. How would one go about writing this? Is something they'll take a prescription to a dispensary? What dose would you prescribe? So how would you start someone on this?
So luckily for physicians in Oregon, they don't have to do any of that, because that would require a lot more knowledge. Okay, now I have to know the doses and the forms and all of these things. The patient doesn't need any of that to go to psilocybin facility, and they can go there and they can work with the facilitator to decide on that dosage. And the facilitators are all trained by programs specifically licensed for Oregon facilitation. So like I said, every aspect of this has been really regulated by the state. And so the physician really just has to talk to the patient and say, hey, to me, it looks like this might be effective for you. You might want to look into trying it. They don't have to say, please go there. It doesn't have to be a referral or any of those things. It's mostly just at this point a discussion you'd have with the patient about whether psilocybin might address the conditions they have. And what we like to focus on, especially in the Psychedelic Medicine Association, because we made an entire course about this, is how primary care doctors can help the patients by doing a risk assessment, by looking, like I said, at the medications they're on, their mental and physical health history, and see whether or not it is likely that psilocybin will be safe for them to try.
So you mentioned some of the risk factors to taking psilocybin. What type of medical drug interactions should one be aware of?
So mostly looking, the number one drug interaction that has been shown with psilocybin is lithium.
Mm-hmm.
And so that's the one to look out for mostly. Other SSRIs, there's still a lot of debate on whether it affects, there doesn't seem to be a huge risk that something bad is going to happen if they're on an SSRI, but it may be that the psilocybin is less effective
Mhm.
because they're both somehow interacting with the serotonin receptor. And so I would say, it's your lithium, it's your antidepressants, antipsychotics. And, if they're on any of those, then, like the Psychedelic Medicine Association, if we have a kind of a chart that shows what type of interaction, if it's a no-go, lithium is more falling into that category. It just happens to be the one that's shown to have some risks. Or maybe like we don't have enough data, it may affect the journey, but may not. And then it's, another thing where primary care doctors and psychiatrists as well may want to work with their patients in Oregon is that the patient may want to taper off their antidepressant to try
Mhm.
that. And so that's another thing that, it's a good thing for physicians to be aware of, that patients may come in asking like, let's work on a taper off schedule so that they can try this. And so it's good to have, doctors know that like that may be a thing that's coming.
Now, how about patient selection? You mentioned that it hasn't been studied in pregnant patients. Any other types of patients that you would not prescribe psilocybin to?
Currently, like I said, patients with a personal history of psychosis and even like a first degree relative with psychosis have not been studied.
Okay.
Patients with schizophrenia, the first studies I think are just happening. So there's not enough data there. Patients either with, and let's say with or with first degree of, for most of these condition, schizophrenia. Studies are ongoing currently with patients who have bipolar disorder. And also we know that, there are two types of bipolar disorder. So we may find that those two are different. It may not
Mhm.
just be that all bipolar disorder patients may or may not be able to undergo, but those are some of the main conditions on the mental health side. And on the physical health side, it's mostly like, how well controlled is your blood pressure? Do you have any risk of heart rate issues? Psilocybin is overall very safe, but kind of the more medically fragile patients on the cardiovascular side, that may be more of a concern as well.
Now, how about states outside of Oregon? Are we expecting psilocybin to be legalized in other states?
So, like I said, in probably a year or two, Colorado will follow
Okay.
with their own version of Oregon, and then other states like California and Washington have had legislation that has been proposed. A lot of states, even on the East Coast and Texas, they're starting to have legislation passed to at least support research. So, even if perhaps there isn't a legalized model, you may have a patient as a PCP who ends up undergoing one of these trials.
Mhm.
There are a lot of trials going on. So it's great to just at least start educating yourself on what your patients may be going through if they happen to be going in one of these trials. But like I said, MDMA is likely to be approved for PTSD within the next year or so, and psilocybin is likely to be maybe a couple of years afterwards. So hopefully this will be nationwide within the next 5 years.
We're talking to Lynn Marie Morski. She's a physician, attorney, and president of the Psychedelic Medicine Association. We're talking about the Kevin MD article, The Importance of Physician Education Regarding Psilocybin Therapy. Lynn Marie, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
I would love physicians across your audience to know that psilocybin and other psychedelic medicines are here, and they're going to be continuing to be FDA approved or more readily available. And so I'd love to have everybody just pay attention, increase their knowledge, because it's not just mental health professionals that will need to know this. They're finding a lot of physical health conditions and chronic pain, cluster headaches, stroke, that are being addressed by psychedelic medicines as well. And so I would love everybody to start familiarizing themselves with those, because these are coming and patients are going to start asking pretty soon.
Lynn Marie, thank you so much for sharing your time and insight. Thanks for coming back on the show.
Thanks for having me, Kevin.